So it was actually being studied to treat cancer, and under NIH, which is a government website, National Institute of Health.gov, you can actually put into the search engine ivermectin and cancer, and you'll see all these studies where research has looked at ivermectin either being used to treat cancers or in conjunction with chemotherapy with some pretty amazing outcome. In the US, I had never heard of ivermectin. I had heard of hydroxychloroquine, but never ivermectin. It was never something that we had. If I had a patient that had scabies, which it treats as well, I would usually prescribe, or not even prescribe, they would use over-the-counter cream, super toxic, where we could have used ivermectin. So I learned about ivermectin when I had COVID and was prescribed ivermectin. And I think that with the amount of research going on with the benefits of what ivermectin can do, it is impeding on the financial profit of Big Pharma. Big Pharma makes a ton of money on medications that are patented. They make a ton of money on chemotherapy. They make a ton of money on vaccines. So why was the treatment of COVID suppressed? It was suppressed because during COVID, for the emergency use authorization of the vaccine, there could not be a treatment for the virus that they were going to do this vaccine for. So they had to suppress ivermectin and hydroxychloroquine so that they could push these vaccines. There's no other reason why. These are super safe drugs. These are world-renowned, over-the-counter in several countries, have saved lives of billions of people, treats river blindness, which is a very debilitating parasitic infection, and it's a natural occurring product. So it's actually found in the soil on a golf course in Japan. God put this here for this very reason, and now we're finding so many other properties. I have patients that have lupus or rheumatoid arthritis or Lyme disease, and I treat them for COVID with ivermectin, and their symptoms are gone of their other very debilitating diseases. So why hasn't this been used? Why isn't this out here? It's cheap. It's cheap and it's effective, and that does not bode well for the pharmaceutical companies, the money giants. So it's all about follow the money. If ivermectin was an extremely expensive drug and very hard to make, then it would be one that would probably be more readily discussed, but it's cheap and it's fairly easy to get. And so the media has to demonize it and make it seem like it's some horrific drug that causes tons of side effects. It is very safe. I take it all the time, and any of my patients that take it feel so much better. Whatever their chronic medical problem was, their inflammation goes down, their pain goes down. So it's all around truly a miracle drug. And I'm so grateful that I was prescribed ivermectin when I had COVID in early 21, because it has been the #1 drug that I have prescribed over the last 3 years. A lot of people say it's a statin or a blood pressure medication. Mine single-handedly is ivermectin. I hope to continue to be able to prescribe it, and it should be in everybody's household. The government didn't really suppress it before COVID. So it was actually being studied to treat cancer, and under NIH, which is a government website, National Institute of Health.gov, you can actually put into the search engine ivermectin and cancer, and you'll see all these studies where research has looked at ivermectin either being used to treat cancers or in conjunction with chemotherapy with some pretty amazing outcomes.